Scapula in the anatomical position. That's the anatomical position where you have the subscapular fossa in view. It's the subscapular fossa that has the origin of the subscapularis muscle, which attaches to the posterior ribs. So really, the scapula is just floating on the posterior upper thoracic cage. Okay, it's just held by muscle tissue. Let's go in order at 12 o'clock. At 12 o'clock, we've got the scapular notch. This border here across the scapular notch to the superior angle is called the superior border. Then we have another border that faces the vertebrae. This is called the medial border or the vertebral border. Then we have the inferior angle and another border on the lateral side. Lateral border, also known as axillary border, because it faces the armpit. So, and you see the glenoid fossa or cavity on the anatomical position. You see the anterior superior projecting bone off of the glenoid fossa, known as the coracoid process. And then we have a projection from the posterior structure of the scapula, which is the spine, the acromion process. So the acromion process is what articulates with the lateral clavicle, acromioclavicular joint. Okay? Now, looking on another view, posterior view, you see the spine of the scapula that separates two fossas, an upper fossa and a lower fossa. This upper fossa is known as the supraspinous fossa. PTs, OTs, you get a lot of injuries involved with the supraspinatus muscle that lies in here. Inferior to the spine of the scapula is the infraspinatus fossa for the infraspinatus muscle. And you can still see most of the structures that you could on the anterior view. We have the superior and inferior borders, angles. You have the superior border, scapular notch, coracoid process, acromion process, dives medially and becomes the scapular spine. It's the scapular spine. This is the acromion process. And you also see the axillary border or lateral border. The humerus is the longest, strongest bone of the upper appendicular skeleton.